Child must feel the father's masculine, robust push for the next step every day. I have a living laboratory at home. My daughter is a medical doctor and my son-in-law is a medical doctor, and we two live on our side of the house and they live on their side of the house. Only 2 doors and a window connect the two houses, nothing more, only 2 doors and a window. So I see a living laboratory of how older one is Nathan, he's a boy, younger one is a girl, Danica, how the two of them grow. So besides my medical training and research, I have a living laboratory to see how children respond. Nathan does not want to sleep till his father comes back from the ward round. He'll keep up at least till 10 o'clock, if father is not at home. Of course, beyond 10 o'clock, he can't fall asleep. But not infrequently, he used to recognize when the father comes back. I don't know how this happens. This little fellow keeps in his memory, I went to sleep without my father by my side. So I'll tell this later again. Every parent, now parent means mother and father. Is that so in Malaysia? Parent means mother and father? Yeah, I'm glad to know that. So that most important thing for the parent at 8:30 is, or 9, both of them being present when the child is falling asleep. This is so very important. This is the priority of your life. Till they are about maybe 12 years. Okay? I mean, some British football club might be about to beat another British football club. That can wait, isn't it? Football can wait. You must be by your child's bedside. And who's interested in football in Malaysia, ladies or men? Pardon? Amazing. In Sri Lanka, more ladies are interested in cricket. There are more ladies in any given cricket match. Okay, that's... So attention. Next one I have mentioned there is impulsivity. These children with ADHD, that they have, their brain tracts have wired in utero before birth or after birth. So in the uterus before birth or after birth, brain tracts have wired to make them impulsive. What is impulsive? Inwardly, they are always set as if on your mark, get set, ready to go. There's a thing inside them. And in medical language, that's called flight, ready to flee, fright. There's a high alertness that borders on fear, and fight. So you'll observe in these children flight, they just take off, fright, high alertness that borders on fear. Thirdly, they are ready for a fight at the drop of a hat or whenever their will is opposed, and their will is easily opposed, they are ready for a fight. Did you understand? Impulsive, set on edge. Now, while I am describing this, we know all this can be recovered. In mild ADHD, very easily. In moderate ADHD, more difficult. In severe ADHD, quite difficult, but can be recovered. ADHD children are completely normal. And normal children should be given drugs or shouldn't be given drugs? No. It's a behavioral issue. So I'll get on to that, to be tackled with behavioral methods. Do drugs help at all in ADHD? Small percentage, very carefully selected by diagnosis and in a particular way, which is really not your topic, isn't it? I should be telling that to doctors, but there's a very small percentage benefit that can be obtained. So you understood impulsivity. The next one is hyperactivity. These children are best described as if they are slipping on a banana skin. You don't slip on banana leaf, you eat on the banana leaf, but you slip on a banana skin. Now what do I mean by that? This is an important demonstration, so you please follow me. If this is at this place, and the mother or father says, please get that thing for me, normal child will plan these steps mathematically. Mathematics is not only saying 9 into 9 is 99, isn't it? 9 into 9 is 99? Then how much? 80? How many of you say 9 into 9 is 80? How many of you say it's somewhere around 80? How much is 9 into 9? 81. So children from their young days is planning mathematics, though not counting numbers. Even the toddler, even the one who's crawling. That's why I advise parents to have a fairly large playpen. Do they understand playpen in Malaysia? So the little fellow is now just crawling. He says, to get to the fence, I have to crawl. He's planning, did you understand how the mathematical logical tract is being developed? He's planning, and you keep the toys or you hang nice things on the fence of the playpen. You remember you do that? What's the purpose? He gets there, he likes it, he gets it and he plans it. And he knows when he gets to the permitted boundary, he must get up. Now all this is wiring up his hand, eye, leg and all the coordination, which is a mathematical step he's taking. So when a child has grown like that, now he's walking, you tell the child to get that and come, he plans, there's a chair here, he avoids it, goes around, there's a glass of water, his grandmother is getting out of the chair, he factors that in and goes and picks it up and retraces, usually the same track back to the mother and gives it. Correct? Now a child who has got wired wrong, this you tell the child there's something there, he'll pretend he didn't hear. Or he didn't actually hear. But he's at that moment doing a tremendous escapade with the Batman upon a wall. Get the point? So you say it the second time, you say it the third time. He heard it then. Then what will he do? He'll take a step in the opposite direction. Like that. And now his mathematical logical steps of progression is not developed, which is management. Some time back it would have been called left brain function. But he has the larger picture, I have to get there. He may fly there, he may go subterranean, he may conduct a commando operation. He's visualizing. Because this child has grown visual rather than verbal. I'll get back to that. I'm drawing a large picture. So the child goes, tick, 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 and grandmother is getting off the chair and he tumbled the water, he slipped on the water, grandmother is getting off the chair, he has no assessment of it, he hangs on the grandmother, she falls. And that's also, but he got it, then takes another route and another dance and comes and gives it to the mother. Little exaggeration, but that's how their brain has wired. Now you understood the child. Good news is, what attention the child did not get, child has to get relearning attention. It can be done. Relearning. And the impulsivity is he does things suddenly without thinking, so he's prone to risks. So child needs retraining and re-management. How do we handle this triad of symptoms? Relearning, retraining, remanaging. And who will be doing that for the child? Therapist once a week? Therapist every day? So recently a couple came and she's quite now advanced in the corporate structure, and her child can't pick up the language. I'll come to that later. Mainly because she was a very active HR manager in a large company. She was practicing HR on everybody other than her newborn child. She said she was hardly at home, comes at 7:30 in the night, and then she still works for the company till about 10:30. What a tragedy, isn't it? Then she sat with me and said, husband was also there, but she was the one who was speaking most. I always direct my questions when I sit as a doctor and I am taking a case history. I direct my questions at the husband. Who do you think answers it most? Really? Then of course I direct it again at the husband, father, just to get him to be responsible. You get the point. Just to get him to own up the child, own up the problem, enter into the problem. So in this case, mother was answering, and at one point she said, so doctor, can you please tell me, please name, we are willing to take him to even 2 behavioral therapists. I said, I know 2 that I know very well. Will you write their names down? So she gets ready to write down. I say, 1, mom. 2, dad. Then they both laughed and it dawned on them. I said, I'm very sorry. My subject is ADHD and ADHD. Speech difficulties, I can't help. But I can tell you why this speech difficulty arose. Lack of attention, I'll tell you about it later. And then she said, no, thank you. It opened our eyes. I believe because I did it in a spiritual way. I sat with them. They owned up the problem. I didn't condemn them. I got them to understand. They went away feeling that they need to do some lifestyle changes. So for ADHD, whom do you treat? The child? Whom do you treat? The child or the parents? Have you come to that conclusion? Or at least make a reconciliation between what the child should do, what the parent should do, and what the teacher should do. Because school has to get involved in this. Okay, I took a long time. You have to write down questions. This is an interactive learning seminar. My lecturing will not change anything till you fully grasp it, take it to your heart, and tell at least 10 more parents next time when this seminar is organized, bring them and come. Is this useful? Is this useful? Yeah. Yes. You know that I don't do this for professional fees, okay? This is a passion that I have to say God put into my heart. So this is done completely free. It's only the course fees and things that are being, production costs that are being charged. There are no professional fees involved in this seminar. But this is a passion. That's why I teach it in a heartfelt way. I expect you to receive it in a heartfelt way. You yourself make a change in your heart and attitude towards your children, and encourage other parents, caregivers, professionals to participate in the next one. ADHD label, children. Now, understanding children, I have done a little classification. You get the child who's impulsive from birth, hyper-impulsive, impulsivity. One does not know what actually went into the child's brain, but the child from day one shows a certain tipped-off nature, meaning the child is on a run-like thing. Those 3 symptoms are present: inattention, impulsive, and hyperactive. Now, in our school of thought, I am not alone in this, we don't diagnose the child with a label of ADHD. Moment you say ADHD disorder, drugs come in fast. We are at the school of thought that a child should be handled with empathic learning therapy, we'll come to that, rather than with drugs. So though we recognize the symptoms, we don't group the symptoms and make a diagnosis of a disease. Okay?